Well, it's great to be here. It's a little hot here in New York, but I think you'll find this session very interesting and fun. I promise you that. My name is Han Park. I'm a physician, head of the global digital health team. I'm very proud of my team and what they've done. And you'll see throughout the discussions of why this matters. And we've selected panelists that not only have deep knowledge in this field, but one consistent thing that each of us have is a passion and the why. And so what I'm going to do, yesterday you heard the announcement and the launch of our Watch 8 and other devices, very thin, very comfortable. And then you heard a teaser, something called Zealth. And then we kind of teased about connected care and gave a little vision and then a lot of PR news about that. But today, you guys get to hear the depth discussion of why this matters and why we think this is much more than Zealth and Samsung. There's something bigger going on, and we're providing a venue where the folks from different perspectives, entrepreneurs to health systems executives, to Samsung looking at consumer orientation to bring that together for a discussion. So with that, what I'd like to do is start with discussion, and maybe I'll get started first, because I've asked each of the panelists to talk about their introduction, but also about their why. My why has to do with my belief in that regardless of skin color, your beliefs, where you live, I think we have some basic needs, and that need is about being loved and to be able to love others around you. I think that's a fundamental foundation that is common to all human beings. And we believe that we are in an area with health, we have the opportunity to care for other people. We also need to make sure that we have to care for those people so we have the capacity to care for others. So to me, health is an important component of that. That's what drives me and my team to really try to improve the health of billions of people. So with that, Mike?
Thank you, Han. And first off, I'm incredibly excited about the opportunity of working with Samsung. They bought Zealth earlier this week, and we're thrilled with what we can do together to greatly simplify care and connect care into traditional provider and clinician workflows. That is so valuable and crucial to the future of care. My why is obviously friends and family. A balanced life is incredibly important to have longevity and health and wellness in life. But intellectually, I have a passion for curiosity, and that's led me to co-founding 6 different companies. That's been my career as startups. Most were in mobile and have worked with Samsung extensively, but I'm now doing a healthcare startup. And we thought that I work with the team. We've been loyal and done many of these startups together. And so using our energy and knowledge around mobile, we saw the inevitability that it was going to bridge into healthcare, and how would we use our talent and passions to bring the mobile skills and development and touch points to traditional care. So we were incubated inside of Providence, which is one of the biggest hospital systems in the country. We created a solution that allows clinicians, doctors, nurses, to prescribe digital things to patients. And that might be an app to manage diabetes or pregnancy. It could be an Uber ride to get someone to an appointment, or meal deliveries to recover post-surgical events. So we built infrastructure to let doctors prescribe digital things to patients, but then because it's digital, there's an exhaust. You know if the patient did it, you know the data coming back, you know a blood pressure measurement, you know a pulse ox measurement. And combined with the Samsung devices, bringing that back into care workflows for doctors to remotely monitor patients is going to be hugely valuable for traditional care. So that's why I'm excited by this partnership.
Rasu?
That's excellent. Well, hi everyone. My name is Rasu Shrestha. I'm a radiologist by background, trained in informatics and business, and I've been doing this sorts of roles for the last 25, 30 years, leading health system transformation and strategy and innovation. I'm the Chief Innovation and Commercialization Officer for Advocate Health. Advocate today is the 3rd largest not-for-profit health system in the United States. In the last 6 years that I've been with Advocate, we've grown it from a $6 billion annual revenue health system to today a $36 billion annual revenue health system with over 170,000 teammates across multiple states. And my why is what got me into medicine in the first place. It's the reason I became a doctor. It's because I wanted to make a difference in the life of a patient. Not just saving patients' lives, but really making a difference in the life of a patient, right? And when I reflect that why against what Han talked about earlier around the importance in this moment in time around connected health, my belief is that connected health really isn't about devices or data, it's about dignity, right? Patients, consumers, the world over are asking us to hear me, to know me, to sense me, to really understand me. And I think that's the opportunity that we have with Samsung and Zells and partners like Hinge and Advocate Health really coming together in a connected ecosystem that can really make a difference in the everyday life of not just a patient, but a person and a consumer. So I'm delighted to just live out my why through this partnership and through this great work, and I'm really excited about the dialogue today.
Thanks, Vasu. Jim.
Good morning, everybody. I'm Jim Pursley, president at Hinge Health. For those of you who may not be familiar with Hinge, we're the world's leading digital musculoskeletal company focused on helping millions of people around the globe move beyond pain, specifically today, musculoskeletal pain. And as Han talked about the why, like Mike, I enjoy building companies. I like to think of myself as a constructive insurrectionist in important fields like healthcare. But the why, you know, everybody in this room, everybody watching online has hopes, aspirations, desires for themselves, for their family. And you think about health, while maybe not sufficient, it is absolutely necessary for all of that. We all know somebody who seemingly has it all, who's at the top of their field, their profession. Everyone envies them for whatever reason, and yet they don't have their health. And very quickly you realize how little everything else matters, and nothing else is possible without that foundational basic element of good health. And so the ability to give the gift of health, to fight for people's health, is something very fundamental and basic to the human condition, and something that we get really passionate about, I get really passionate about. And it's a pleasure and privilege to be on stage with all these other great people who are pushing in the same direction. So thank you.
And you may be wondering, why do we invite Hinge Health to the panel? I think one of the things that's very clear in the healthcare world is that while digital health investments have increased year over year, scaling has been a major problem, and only a few companies have really shown the ability to scale, and Hinge is one of them. And that's really why we've asked Jim to share with us his perspective, because there are a lot of challenges that exist in the traditional healthcare that make it difficult to adopt digital tools. And so health systems are trying to manage costs, increase quality, workforce shortage issues in the midst of that, chronic diseases increasing, right? These challenges exist in a major way. And so I think what Mike and I have been thinking about is like, what is our role from a technology perspective to bring this together? And I think the one thing I'll tell you is that while Samsung's large, we're not going to fix this problem alone. That's just not going to happen. I think it's going to take a village. I think it's this community that comes together and figures out how to scale. So with that, maybe I'll turn to you guys to say, given the vision for connected care, I think most of us have this idea of what this nirvana state looks like when it's all beautifully connected with dignity in the core of the person in the center. But what are the challenges today from your perspectives that is standing in the way of you doing those things? And then if you could, we'll segue into what are the things you're doing as a second part. Vasu, maybe you could start. One of the largest health systems, You got huge challenges, and of those, what keeps you up at night?
Yeah, no, absolutely. Thank you, Han, for that opportunity. Look, healthcare is hard. It's really hard. Many have tried to come into healthcare outside in and tried to solve for healthcare, right? Startups, large tech companies, pharma companies. The reality is that with all of the challenges that exist in healthcare, it is not any one entity that can heroically go in and save healthcare. It really takes an ecosystem. And that's part of the reason why I'm so excited about Zelf and Samsung and partners like us really coming together to solve for this challenge, because it is about Samsung enabling more of an open ecosystem, curated ecosystem of companies, health systems, payers, providers, organizations, patients, consumers, really coming together. And from a health system perspective, I see a number of challenges and opportunities, right? So let me put out 3 out there. For the longest time in healthcare, and I've been doing this now for a while, we're always talking about patient-centered care. And as a physician, I got to tell you, it is important, it is critical, right? You always have to have the patient in the middle. But the opportunity here is to broaden that aperture from patient-centered care to person-centered care, right? So that we can then move from more of an episodic, broken, and fragmented care methodology and business model, that's the business model that drives healthcare today, to more of a connected, ubiquitous, always-on system of health, right? So the first is really moving from patient-centered care to person-centered care. The second, and we're really pushing for this at Advocate Health, is broadening that aperture from just more of a hospital-centric way of providing healthcare to more of a connected care everywhere strategy, right? I talk about it as moving from bricks and mortar to clicks and mortar, right? Look, home is where the health is. Hospitals will never go away. I'm a radiologist, right? We're going to need scans, surgeries, right? Procedures. We're human beings. We're going to break down. Hospitals will not go away. But I see with what we're talking about today with Samsung and Zelf coming together, the opportunity to really reposition hospitals also as what I call care traffic control centers. They're watching out across the communities that that hospital is a part of and caring for those individuals, not just the patients, but the persons, the consumers. And I think that's really important, and bringing in AI and those nudges and technologies and capabilities. The third really is about the biggest challenge that we've had in healthcare today, which is it is highly transactional. Very transactional, right? It's about ICD-10 codes and CPT-9 codes, and it's about billing codes, and it's about schedules, and it's very transactional. Yet we, consumers, people, human beings, all of us, live in an environment where it really is about experiences. So the opportunity to elevate healthcare from transactional healthcare to experiential healthcare, that's the other big opportunity that I'm excited about with Samsung and what we vehemently are pushing forward at Advocate Health.
What do you think about, Rasu, about U.S. spending about 3% of our budget on prevention, yet 25% of the cost is based on preventable diseases?
Yeah.
How do you get your head around that as to how you as a system think about that issue and how we think this potentially moves towards that?
Well, ask me the most difficult question here for sure, Han. Yeah, let's do that. Look, healthcare is broken, and part of the main reason it's broken is what Han just articulated, right? The incentives are misaligned, right? You know this, we know this from our everyday habits, right? If we're incentivizing our kids to do the right things, they will do more of the right things, right? But if the incentives are misaligned, then the entire system just starts to fall apart, right? So the opportunity here with what Samsung is now enabling, this connected ecosystem of devices and data, really going after the dignity of those patients, those consumers, in a much more connected ecosystem way. So it's not a closed system, a fragmented system, a broken system. that is how you actually solve for the business model that is broken today. That is how you actually align the right incentives. And we could go deeper into what does that then mean from a provider and a payer perspective and reimbursement and all of that. But that's for another day. But what I am telling you is it takes more of that connected ecosystem approach that today Samsung is enabling. So I'm really excited about that.
Thanks, Vasu. So Jim, you've really tackled one of the largest problems in healthcare, musculoskeletal, a huge part of our spending, huge implications on patients, their ability to just even move around. The mobility is a huge aspect. Tell us your journey a little bit and how you're solving those challenges to some degree.
Sure. So as we mentioned, we're focused today on musculoskeletal pain. 40% of Americans today, and that's true really globally, will experience some type of musculoskeletal pain. That's joint, hip, knee, back pain in any given year. And there's a tremendous cost associated with that, whether that's surgery, pharmaceutical interventions like opioids, and then obviously all the downstream societal cost of that. And so we focused on how do we bring conservative care in a way that's convenient, accessible, affordable, because we know that conservative care clinically, all the research shows that conservative care works, but it's inconvenient, it's hard to access, it's expensive. So that was the journey that we set off using technology. And I think over the last 10 years, we've done a really good job of proving that we can approximate in-person care, physical therapy specifically, with technology. We'll probably touch on some more of that and how partners like Samsung really help enable that in future questions here. But the thing with digital health, not just Hinge, but in general, is we've operated historically independent of the traditional healthcare system, independent of an advocate. And so while you get a delightful experience in your Hinge ecosystem, we sit outside of traditional healthcare, which is still a critical and important and huge part of our healthcare. So I think the next decade of innovation is not going to be for us as digital health companies showing that we can digitize the analog world, is to show that we can elegantly integrate with traditional in-person care to create a unified experience for patients, for members, where they don't have to, it's like banking, right? We don't think about we're going to do digital banking today, and you have a digital banking app, and then you have your real bank, and they don't talk. It's just banking. And sometimes it exists on your phone, sometimes it exists in a branch, and you just kind of subconsciously navigate between the two, and it's just known as banking, retail. But healthcare is not that way today. Healthcare is, there's digital health, and then there's healthcare, and that has to change, and we're working really hard on unifying those two, and partners like Zelf and others are taking a really important step to help us bring together that experience in a unified way that I think our members, our patients will love. It'll produce better outcomes, and it'll produce lower costs, and that's the last point. If you think about consumer electronics, really anything, technology has a deflationary impact on that thing. So you think about the smart TV in your family room, you think about the phone in your pocket, the watch on your wrist. Technology, computing power increases, costs come down, except for in healthcare. Technology is not deflationary in healthcare. And that's a problem, and we've got to change that. And so I think we're going to push for that, and there's a lot of reasons for that. But I think those two are on the slides is what problems we're trying to solve. That disconnected, fragmented experience, let's unify it, and then let's really use technology in a smart way to have a deflationary impact on healthcare, so we can spend more on prevention and less on care.
Yeah, Jim, I think you reminded me in my days in telemedicine, early days, this is before COVID, the board of directors at the American Telemedicine Association sat around and said, what does the future look like of telemedicine? And someone said, it'd be really good if telemedicine went away as a word. And I think the same true is digital health, AI, that these things get in the background so that we can focus on the person. Because I really like what Vasu said. I think it's the orientation and it's the mindset. When we look at a person and say, that's my patient, I'm now thinking of vital signs and past medical history and all this. When I think of it as a person, I think of what are their needs? How are they living day to day? How are they sleeping, right? It's a complete mindset change. And this is kind of, I think, as part of the healthcare organization, our systems needs to change in that orientation, so I really appreciate that. So Mike, what do you see as the major challenges in front of us?
Well, I'll go back to why we started Zelf in the first place. One of the challenges we saw we didn't have a background in a clinical area. I wasn't going to solve cancer. I wasn't going to solve diabetes. So what am I good at? And that's introducing technology to solve problems. And one of the problems that we saw was there was no infrastructure laid in place for digital health. And so I would say the challenges that we solve go in 3 dimensions. The first is infrastructure. Just like you don't get Denver, you don't get Chicago until you build the railways that bring freight, and they allow for populations, they allow for goods, they allow for building materials. So you needed infrastructure deployed in order to build civilizations and scale on top of that. And so we had to figure out how to get our software to work inside of the electronic medical records, Epic, Cerner, and as such, we now work with 30 of the largest hospital systems in the country, Advocate, Providence, UPMC, Mass General Brigham, Banner, Duke Stanford, et cetera. So we're quite proud of the company that we keep. I think we have a stat of 7 or 8 of our hospital systems are the largest employers in their state. Think of that. That's the scale that these hospital systems operate at in the US economy. So you had to build infrastructure, and then we convinced Oracle Cerner to invest in us and resell us. So you need to get that infrastructure in place. And then you need to scale it. And an analogy I use is 10, 20 years ago, doctors used to write a prescription on a piece of paper. And somebody would take a piece of paper to a pharmacy to get their medication. So now 98% of all meds are e-prescribed. There's a single vendor that routes all of that to the pharmacy of choice for that individual. We want Zelt to be that ubiquitous infrastructure for routing digital health assets. And we've integrated over 70 different third-party companies, Hinge at Stanford, and we do diabetes apps, we do behavioral health apps, we do surgical prevention apps, we do PT rehab apps afterwards. And then you also do meal delivery services and Uber rides. So we're kind of agnostic as what the doctors think are relevant for that patient. And then when we round trip that, we see the data coming back in. So we want to be able to benchmark the digital health effectiveness. We want to know what diabetes program works best for a 70-year-old Hispanic woman versus a 30-year-old Asian man. There's going to be differences in behavioral change for those different audiences, and because we see all that round-trip data, we're going to know what is the best recommended solution for that individual. So infrastructure, and then scale, and then organize. So when you prescribe a med, software sort of figures out, oh, you're on this health plan, you work for this employer, this generic is appropriate for you, this name brand is eligible for you, there's an eligibility criteria. That doesn't exist in digital health right now. Whereas I saw the stat the other day, 93% of all Fortune 500 companies have a mental health app available to their employees. It's showing clinical effectiveness, it shows ROI. Does Medicaid reimburse for that? No. Does Medicare reimburse for that? No. So you have the most disadvantaged patient populations in the country. These are proven clinically effective, but the government doesn't pay for it. So doctors at point of care don't know whether a patient is Medicaid or Medicare or works for Intel or works for Samsung. So they can't do the discernment of what this patient is eligible for. So ultimately, that's what we're going to have to organize and scale around, is you prescribe the right app to the patient that's going to be clinically eligible, that there's some beneficiary paying for that, because you can't expect the patient to pay out of cost. And this is all proven cost effective, so the whole industry should adopt this.
I think let's go to part 2. And you've kind of addressed a little bit of it, so I'm going to make a little adjustment if it's okay. Clearly, from a Samsung perspective, what we're interested in doing and what our customers have told us is to say, look, don't just tell me what my problems are. Just don't tell me I'm sleeping poorly. Tell me something useful so I can actually do something about it. And that got us to really thinking, all right, we can give you the data in a meaningful way, easy to understand, give you insights and maybe even a little light coaching. But then what we realize is that we have people like Hinge and others that are doing some amazing, innovative things. And we said, what would that look like to be able to connect a marketplace of innovative solutions and kind of like a matching program where we take the need of the person, because what we're good at the end point, with our wearables and our sensors, we know when things happen. It is those contextual changes by which we can then connect them to the needs that they have as needs change. And so part of this is about creating the end-to-end experiences, bringing together partners like Hinge, like others, through Zell, being able to make it easy to actually deploy and monitor. That is our vision. In terms of our wearables, you are now seeing, we have VP Choi, who's heading up a lot of our R&D. We're working on some amazing sensors this year. The antioxidant index came out. We have the sleep guidance out. We have the running coach. This is going to continue on to do some amazing things. So expect us to bring out more of those features. But at the end, regardless of the sensors or the measurement, what we're beginning to really do passively is to make it easier for people to understand what's happening in them, around them, and to be able to then share them with a care circle, whether that's family, physicians, because as you know, health is hard and it's a team sport.
Yeah.
But what's really exciting for me is that I think 10 years ago, while this conversation would not have been all that different in terms of concept and vision, what is different now is AI. AI now can do things in two ways that are very specifically different: hyper-personalization and scaling. Because if you think about coaching, we all need coaches, but you can't deploy thousands of coaches with thousands of skills, right? It's just not scalable. And we have a healthcare workforce shortage. And so these automated tools with AI, I think now we have the ability to start executing. And so, as all of you know, AI has changed our lives forever. The question now is, typically healthcare is a little slow to adopt, but I think I don't see that slowness now. I think I would love maybe Rasu to take on that, and because at the end of the day, for me as a physician, it's humbling, because what I tell, even if I got my diagnosis and treatment right, whether that person decides to listen to me and says, I will change my behavior, I will exercise more, I will sleep better, that is disproportionately higher on the outcome of that individual than what I can do. That is reality. Therefore, a lot of this is about, can I use AI, not only in the back end to collect data from different sources, including hospital, but in the front end, nudge, engage, understand where this person is, and then at the right moment, encourage to change that behavior and make that easy. I think that's really the exciting part of where we are. But Rasu, from a health system, this is a huge issue. You're a doctor. Yeah. What are your thoughts? And then if you could begin to say, what are you doing as an organization towards that end?
So, from a physician perspective and a health system perspective, I'm a big believer in digital. Right, all things AI and devices and data and the power of digital, especially now with Gen AI and agentic AI, I'm just thrilled. The quality of the sensors, where it's more medical grade than even consumer grade, I'm just absolutely thrilled with the power of digital. The challenge is that if you take digital and throw digital at a broken process, you end up with a broken digital process. Okay, so what we need to do, and the power of Samsung coming together with Zelf, working with companies and entities like us, is to really say, all right, what is the root cause of those challenges? How do we address the broken processes so that we can bring in the power of digital and AI and connected devices and sensors and really then bridge the divide, right? So I've been a big-time fan of Zelf. Right from its early days, when Providence, as was mentioned earlier, really birthed Zelf. And UPMC, which is where I was prior to Advocate Health, we invested in Zelf. And I moved to the Carolinas, and Atrium Health, which is now part of Advocate, invested in Zelf. And then Advocate Aurora, we invested in Zelf as well. So
He's bought me 3 times.
3 times. So big
Now
time,
the 4th.
big time believer in the power of Zelf. And now with Samsung and Zelf as part of Samsung, the opportunity that I see is to really go after these pain points and these broken processes in a big way, right? Because the reality of what has happened prior to this coming together is that there are 2 different worlds. There's the world that I reside in as a health system, as clinicians and providers of care, whether it's in part of a hospital system or in the practices that you offer in Hinge. And the data resides in what we call our electronic medical record systems, right? It's siloed, it's fragmented, it's locked away. Patients, consumers, we reside not in the EMR, the electronic medical record system. We have our phones, we have our apps, we have all these sensors and devices. We have our world where we eat, work, live, and play. Zelf brings the power of bridging those 2 devices, or those 2 divides, excuse me, in a very bidirectional manner, right? And Samsung, with the open ecosystem of applications and capabilities, really then enables what we need in healthcare, what consumers are asking for in terms of what I was referencing earlier. Let me give you a real-world example. So one of the things that at Advocate we were able to really address from a broken workflow, bringing in the power of digital and the bridge-building capabilities of Zelf, was really around pregnant moms, right? So pregnant women, when they go through the journey of pregnancy, the moment they're confirmed as being pregnant, what we're able to do as physicians is actually send them a secure text directly to their smartphone, and they're able to then sign up for this digital pregnancy journey enabled by Zelf. So much like how today, in the electronic medical record system, I'm able to click a button and prescribe a medication that ends up in the pharmacy of your choice near where you work or where you live, we're able to do that leveraging the power of Zelf, and that pregnant mom suddenly has this curated ecosystem of care that is digitally enabled, right? We're also prescribing to her, as an example, digital blood pressure cuffs that she walks away with, as well as digital apps. And what we're able to do then is to provide more of a carefully curated, evidence-based envelope of care throughout her pregnancy journey. So for patients who have high blood pressure, a condition called preeclampsia, we're able to monitor that, we're able to nudge them towards healthier behavior. We have this bidirectional interface between the consumer, the patient, the person, and the health system and the electronic medical system, right? And we're able to guide them in the right care protocols and ensure a successful pregnancy journey, right? And what's really interesting is, as a result of what we're able to do, this is not just a pilot, we're able to then scale it to the point that Mike was mentioning earlier. And as a result of that, we're able to see 48% greater adherence, and more than 80% of those patients, of those moms, in their second pregnancy wanted to come back to our system because we're able to offer this, right? So it's that level of really solving for those broken challenges and those problems, and being able to then bring in the power of digital and AI and sensors and connectivity in a very human-centric way. I think that's what's going to make a big difference, and I'm really excited about that.
Yeah, I loved how you gave that example. Yeah. Jim, I think yesterday when we were talking, you had the analogy to the online banking, offline banking. Maybe you could start there, and then in the MSK world, maybe you can give a similar example of how this issue comes to play.
Well, I think Rasu did a nice job of covering how Zelf and partners like Advocate are doing to connect care. I will say one quick thing on that. The next level is going to be really exciting. When that woman who shows up with the pregnancy app that her employer provided her, that wasn't the one that Advocate was providing, and through Zelf, the provider now can integrate that data and allow her to use the app of her choice to get the care. That is going to be the next level of digital health. That's going to be really exciting, and so I applaud Advocate and Zelf for pushing in that direction. But other than just connected care, we talked about affordability and accessibility. And I think AI, I don't think we can underestimate the impact that companies like Samsung are having on affordability and accessibility. So what I mean by that is, You think about, so for Hinge, computer vision is a subfield of AI, and human pose estimation is a subfield of computer vision. Highly computationally intensive, requires historically purpose-built devices, high-end cameras. Now, as companies like Samsung develop powerful computing in your pocket, rich camera technology embedded in smartphones, we're able to do things on the edge computing. We're able to do a sophisticated computer vision technology right in your pocket, eliminating the need for expensive hardware. We don't have to ship purpose-built devices. We're able to, as Rasu said, where you live, work, and play, we're able to let you engage with having a physical therapist in your pocket because of the power of a Samsung. We're able to take advantage of that. Sensor technology is the same thing. If we're looking for temperature, respiration data, whatever it is, this idea that we have to develop purpose-built devices, that adds cost, it adds complexity, and that's not how any of us, again, want to live with a whole briefcase or purse full of purpose-built devices from a dozen different app companies. We want to be able to leverage the technology advancements that are happening all around us, both in AI. And so we're really excited about the work that Samsung is doing, not just in health and sensors, but just in the core consumer electronics platform. It enables and unlocks so much opportunity for us to allow you to get the latest, most sophisticated AI technology, right in the palm of your hand. So, we applaud that, and as a result, back to the scaling question, it's allowed us to scale because you really can't. Purpose-built healthcare is not scalable if you're talking about helping billions of people around the globe. So, we're really excited, and again, as you see, as we push forward with AI, a lot of that's enabled by companies like Samsung and the work that you're doing.
Sounds great. Thank you so much. Mike, you want to add anything? Because I think Rasu talked about this world of wellness and consumer where life happens, where family happens, and then there's the world of the walls of the clinic and the hospital. And you clearly had a vision and began to build a bridge to deploy. How do you see the next set of challenges and how you're thinking about that?
Well, I mean, honestly, that's why I'm quite excited by Samsung as a partner to scale this vision. Just like this replaced so many standalone devices, there used to be film cameras, then digital cameras. This has replaced that, replaced GPS units, replaced maps. This plus your devices, the watch, the ring, are going to replace the standalone blood pressure monitor, the pulse oximeter, the variety of different devices, CGMs, et cetera. It's going to be one package solution. And that's going to simplify care. It's complex for the hospital system to discern someone getting released from a lung transplant surgery. What do you need to use to remotely monitor their health? Someone getting released from a ortho procedure. What do you need to remotely monitor their recovery? Each procedure requires different levels of remote monitoring. If one device could do so many more elements of that remote monitoring, you're simplifying care, you're reducing costs. And you're going to introduce the number of AI elements to discern of all these different data points of the patient in their home, their health, their daily lives, what brings signal back to the hospital system and the doctor? The doctor is going to be the center back, the quarterback of your health. But the average American sees the doctor twice a year. Twice a year. What are you doing the other 363 days of the year? How does the hospital system have any visibility to that? Bringing that connected visibility, and not in raw data. Doctors are too busy to just think about that, day in and day out. How's John doing last week? I saw him, and I told him he should go get that med, and I told him he should, walk 5,000 steps. They're not going to check on that. But if the signal knows what was recommended to that patient and whether the patient did it or not, and it was going to lead to very, very adverse consequences, you alert the clinical team to intervene as necessary. And we prescribe a lot of mental health apps, depression apps, and there's a questionnaire survey, and one of them is, are you feeling suicidal? Depending upon the patient's response to that, the severity escalation goes paramount to intervene and talk to that patient to see what's wrong, because you don't want to lead to tragical consequences. So remote monitoring patients saves lives, and we've got lots and lots of examples to prove that, and that's why I'm in healthcare, because I wanted to make a change globally with different technology solutions that bring cost reduction and better quality care to the populations.
Great, thanks, Mike. So we'll transition into the last part, which is really about how we see the future. So I'm going to ask each of you to draw for us what this future looks like in 10 years from now. How will our healthcare system have evolved with the assumption that what we're doing is finally going to change and open up the world, the two worlds that had been separate? Jem, you can start and say, what is your business? And how does healthcare overall, how does it look different, especially given where AI is going?
Sure. We have a belief that almost all non-touch elements of healthcare will be able to be automated through AI. There will still be a need for in-person healthcare, but the vast majority of non-touch healthcare that we experience today can be automated through AI. So we're investing in it, others are investing in it heavily. But then how do we, again, I think that's going to happen whether Hinge pushes for it or not. It's either we're going to be a part of it or not, but it's going to happen. I think this idea of unification, though, is something that we've got to get collectively more serious about because we don't have a great track record of developing innovation that everybody can embrace and adopt. And I think that's the next step, and again, others, Mike and Zelf, are helping to lead that charge. So as we develop sophisticated digital technology, you'll start to see us make announcements. We just made one recently with an offering we have called Hinge Select, which is starting to reach back out into the physical world and connect people, connect the data to in-person providers, best-in-class providers who have agreed to share data back and create a collaborative ecosystem so that our members can get that MRI that they need. We don't deliver MRIs. AI may digitize the reading of them, but there's still a physical device that needs to, and so how do we get somebody to a high-value, low-cost imaging provider? How does that image get read quickly, cost-effectively? And then how does maybe the orthopedic surgeon and the AI physical therapist, how do they collaborate? Which sounds kind of science fiction today. But 10 years from now, I don't think it's going to be science fiction, and I think we're going to really push, I know we're going to push really hard to make that a reality, and we're already starting to see the early signs of that, so we're really encouraged.
Good. Rasu?
10 years. 10 years is a long time. It is a long time, especially given the pace of change that we're seeing with the power of AI, with the power of sensors and devices that Samsung is bringing to the table. It's a long time. I do feel that in 10 years, we're finally going to get to a point where healthcare is not about surviving, it's about thriving. It's about leading your best life possible, right? Contextualizing it to your wants, desires, needs, capabilities, and maximizing your potential. It's not about getting better from an illness. It is about leading your best life possible. I think that's the state that we're going to get to in 10 years, but how do we get there, right? So at Advocate Health, we just launched what we call our Rewire 2030. It's our next 5-year strategic plan. And as part of Rewire 2030, one of our highest priority items meshes directly with everything that we're talking about here today. And it is our priority of what we call health at home and wellness. That is one of our 6 strategic differentiators that we are betting on, we're investing heavily into, and we're building directly around in terms of how we're evolving as a health system. Another part of our Rewire 2030 paradigm is what we call our innovation partnership ecosystem. Right? So as we look into the future, just in the next couple of years, not even 10 years, in the next couple of years, our belief and what I'm excited about is really building this innovation partnership ecosystem to drive towards some of the specific things that we just talked about on this panel today. So I'm superbly excited about where we are. And I think what it takes is a willing set of partners and collaborators that are enabled by the set of technologies and capabilities in this more open ecosystem approach that we're talking about today. And that's what I'm really, really excited about, because at the end of the day, it's going to make a specific set of differences to the quadruple aim. We call this the quadruple aim that we in healthcare have been struggling for, not just in the last 10 years, but for decades at a time, right? Cost. Han referenced this earlier, right? If we're able to do what we just talked about on this panel, we're going to directly address some of the core issues around the cost of care, because we're going to shift the conversation from patient-centered care to more of a person-centered care approach, right? Quality. The quality of care that we're receiving has to change. It has to continue to bump up, right? Access. Access is a big issue, especially in the United States. 96% of the country is rural America. And it gets really rural very quickly when you go outside of New York City, when you go outside of a city like Charlotte or Chicago or other metropolitan cities. So how do we make sure that access gets directly addressed? And then, last but not least, is experience. Right? What I mentioned earlier in terms of transactional healthcare to experiential healthcare. I see all of these elements really playing out in a fast-forwarded way in the next several years as a result of what we just talked about on this panel today.
Sounds great, Rasu. Mike?
I absolutely agree with what had been said previously, and it's unsustainable to keep the costs going up, as Rasu said. The country just can't absorb that cost and the spend against the GDP that we've got in this country. So we have to use the deflationary technology to improve quality while reducing costs. And the future is going to focus on that. I mean, Samsung has penetration of over 70% US homes have Samsung devices. TVs, washing machines, refrigerators, phones, tablets. All that's going to play ambient sensing. And as we discussed, there's access issues. It's more convenient to get care at home. There's a clinician shortage. So you're going to have more and more remote care available, and the home is going to take care of more of that nudging, behavioral change, preventative care. That's where this whole country needs to go, is instead of sick care, but the reimbursement shifts, the dynamics, the economic incentives that focus around prevention, chronic care management, and reduction of hospitalization and services. So I firmly believe that technology and what Samsung and the rest of us are trying to do is really going to improve the quality of care moving forward, and we're all going to live happier, healthier lives.
Yeah, I really like some of the key things that I'm teasing out. One, I heard, just as when the United States after it was founded, the economic prosperity came later when the infrastructure was laid, when the highways and the rail system, when those became available, people then were mobile and began to invest around those transportation routes. In the same way, I'm looking at digital health. As we look 10 years from now, I bet many of you probably don't realize this is probably one of those sentinel moments we'll look back and say, you remember when? And this is when the bridge was built. Not a one-lane bridge, 6-lane, 8-lane highway, where prosperity and digital health innovators like Hinge and others are able to thrive because those infrastructure pieces. And so in that regard, I think scaling, will become a thing. The other thing I have come to realize is that prevention, there's a lot of reasons, including incentives that Rasu talked about as to why prevention's not as much aligned or is not as successful as one we would think. But the other thing I've realized is about the connection between when you go to a doctor and the doctor says, here's your prescription, here's your imaging study I want you to do, and oh, by the way, I want you to lose 10 pounds, I want you to take your medication regularly, I want you to take a blood pressure because I noticed all those things become something that you remember, maybe on a piece of paper, and then you go back home and life happens, and those things just don't happen. So the care doesn't start in the home only. Care starts as a set of instructions that don't have a place to go right now. Imagine when the bridge is built, those care actions or care becomes actionable as a nudge on your watch in different ways with a health AI coach. Just want to make a note that at the end of the year, we're going to be launching a beta version of a health assistant, health coach, that is holistic across the 4 pillars. It is our beginning of our journey, but I'm very excited about what this means, because to date we've been giving you, here's what you do for sleep, here's what you do for activity, but we're not pieces, we're a whole. And so we've embarked on this journey. It's going to be imperfect. I'll be the first one to tell you. But you know what? Experience it, give us feedback, and we'll continue to evolve it so that we can envision this part together. So next slide, please. I think as we close, I want to thank the panelists for a great discussion. I hope the audience really at least took out a few things. But if you don't remember anything else, I hope that you'll look back and say, healthcare changed today. And I really mean that from the bottom of my heart, because healthcare really needs change. And it's not the lack of innovations, it's not the lack of great physicians. It's somehow the infrastructure pieces and the things that AI now can do for hyper-personalization, hyper-contextualization, and scale now gives us hope to be able to do what we need to do. So I want to thank the panelists. If you could give them a warm hand. So would you mind closing with just last thoughts to encourage, right? I think we've been a little bit depressing on how bad healthcare is. Tell us something hopeful about health into the future.
Something hopeful about health. Well, with about 25 million Americans covered by Hinge today, my chances are some of you in the audience may have access to Hinge. If any of you have hip, knee, back, shoulder, elbow, neck, whatever kind of musculoskeletal pain, check us out and see AI, see the power of technology at work as we're able to approximate physical therapy in the palm of your hand. I think as we keep pushing forward, folks like Mike and the Zelf team, Rasu and Advocate, I think what you need to keep pushing us for, all of you in this room, is to connect the dots. Han said it well, there's not a lack of innovation, there's not a lack of good doctors, there's not a lack of a lot of clinical technology, there's a lack of unification. Push us to unify. Don't accept, be constructive insurrectionists in this fight to unify care, to elegantly integrate the physical and the digital. And I think if we can do that, build that infrastructure, then we're going to be in a lot better shape than we are today. And I'm really optimistic, and I'm really bullish on the future. So thanks again for having us.
I guess you have to be an optimist, be in this field, right?
You do, you do.
Rasu.
Yeah, so the word I'd share with you is hope. You know, the panel, the conversation, the events that are happening as a result of Samsung and Zelf coming together, and the dialogue that we're having here just gives me hope. It gives me hope that finally we'll be able to solve for some of the biggest challenges that exist in healthcare today, right? And when you look at the dynamics that we're struggling with, there are also so many tailwinds that are propelling us forward, right? The capabilities around AI and devices and sensors, the infrastructure that's being laid out, the bridge building that is out there, as well as the imperatives to move the economics of healthcare in the right way as well, through those digital nudges that we're talking about. And then from a policy and politics perspective, you're hearing of, well, every citizen in the United States needs to get a wearable device. That's fantastic, right? But it's not just about those devices, it's about the infrastructure, the capabilities, the data elements, the bridging that we're talking about today. And I think it is really the hope that comes together in this confluence of opportunities and challenges and this moment in time that we can then create this ecosystem that is welcoming of all. So really excited about this, and can't wait for what's next.
Hey, Rasu, quickly, I'll just jump in there. Speaking of policy, the recent Budget Reconciliation Act that was just passed, the Telehealth Safe Harbor Act was extended permanently. I think in a bipartisan way, there's a recognition that better is possible, and we have to create both the technology innovation, but also the policy and payment frameworks that allow innovation to flourish. And so that was a real encouragement to see that both sides of the aisle recognize.
So my 30 years of telemedicine work actually paid off a little later.
The bad news is we're still calling it telemedicine. The good news is we're supporting it. So.
Yeah.
I'm a perennial optimist. I've done 6 startups. You have to come to the world, with ambition and aspiration. But and a lot of what we're talking about here is incremental change. You have behavioral change, you have humanity, you've got civilization, you've got infrastructure. That's incremental change. Especially now with AI, you've got pharmaceuticals that are curing diseases, and you're going to get more of that with AI. And the imaging quality and the brain-human interface now, there's going to be exponential change that is going to create massive, massive changes in our lives that's going to improve our lives. And that is yet another thing that we can't see the future, but it's inevitable. And that's going to be exciting.
Yeah, I'll close us with just a couple of comments. One, through this news, through our partnership with Zell, with Advocate, with partners like Hinge Health, the clear message is Samsung's in it for the long run. We're committed to health. It's an important thing that we feel that we are in an amazing position as care is shifting to the home. So please know we are serious about what we want to do, and we want to make it then. Please know that many skeptics out there will say many great people have come and many dead bodies have been strewn along this path for trying to disrupt and improve healthcare. But also know that Samsung started as a grocery store not that long ago. That is now a global technology company innovating for the future. It gives me hope that we can do what is unimaginable. But what's more important in my mind is that this is not about Samsung changing healthcare. It's about Samsung in its ecosystem and enabling and bringing those players so that we together can make health a reality. Thank you very much.